want to introduce myself first. My name is Sandy Fitzpatrick, so I'm the Participant Care Coordinator, registered nurse at the West Island Cancer Wellness Center. I will have my colleague Debbie Magwood, who's the Executive Director, who will be evaluating, assessing. So what we will do during the workshop is Vicky, when I introduce her, will be talking. And I will have certain questions to ask Vicky. If anybody has extra questions, to please write them in the chat box, and Debbie will be monitoring the extra questions. So it's important that everybody stays muted except Vicky and I, so less noise in the background. So I first wanted to start off because I know that it's been open to the community that I wanted to talk about the West Island Cancer Wellness Center. If some people are not aware, it is for people who have been diagnosed with cancer, who are still in treatment, post a 1-year treatment. So it's for the mind, body, spirit. So definitely with COVID, things have changed. We do still have some programs at our beautiful house in Kirkland. And now we do have some virtual programs who have been right now across Canada. So people who have been diagnosed with cancer in treatment have been able to have access to our virtual programs across Canada, which is quite beautiful. I think that's it. So I think what I will do is I will begin. I'm sure some people will continue coming in. So I'm going to start, and I'm very excited to introduce our special guest today, Vicky Rizothanassis. I may not say her last name right, I'm really sorry, who has a bachelor's in science. A naturopathic doctor, will be speaking on the topic of cancer and naturopathy. J'aimerais souhaiter la bienvenue aujourd'hui à Vicky Rizothanassis, qui a un bachelor en science et une médecine en naturopathique. Vicky has always been interested in the mind-body connection and its impact on health. She studied psychology in university before embarking on her postgraduate studies, where she went on to receive her degree as a naturopathic doctor from the Canadian College of Naturopathic Medicine in 2008. The Canadian College of Naturopathic Medicine is one of the 6 schools accredited by the Council on Naturopathic Medical Education in North America. She is a proud member of the Canadian Association of Naturopathic Doctors and the Quebec Association of Naturopathic Medicine, and is registered with the College of Naturopaths of Ontario. So welcome, Vicky.
Thank you. Thank you for the introduction, and thank you for including me on your workshop series. I think this is great.
Definitely, it'll be very interesting. A lot of people have been wanting to know more and more about naturopathy, exactly what it is. So definitely, we are honored to have you with us for the West Island Cancer Wellness Center.
Thanks. I'll tell you a little bit about naturopathic medicine, and then I wanted to go over a few things, and if you have questions afterwards, I'd be happy to answer them. So there is no regulation in the province of Quebec for naturopathic medicine. That's why lots of people either don't know about us or they get very confused as to what we do. There are about 15 naturopathic doctors, maybe a few more now, in the province of Quebec, mostly in the Montreal area is where they're practicing. But there are about 5,000 naturopaths. We're not title protected, so people can take a weekend course and just call themselves a naturopath. So it does get very confusing, unfortunately, for people. We are trying to change this. Hopefully, we are making some headway, I think. So hopefully things will change in the near future. Our program, as Sandy mentioned, there are 2 schools in Canada that are accredited for naturopathic medicine. One's in Toronto and one's in BC, just outside Vancouver. And I went to the one in Toronto, but I am from Vancouver, actually. Our program is very similar to what a medical doctor would study in school in terms of the basic sciences and the clinical sciences in terms of physical examination, laboratory diagnosis, diagnostic imaging, pharmacology, all those kinds of courses. Where we differ is in year 3 and 4, where a family doctor will focus more on pharmacology and emergency medicine. We focus more on clinical nutrition, herbs, Chinese medicine, acupuncture, things like that. We do get to spend more time with people. So we really do want to look at all aspects of someone's life to see what could be contributing to any problems. And sometimes people just come to us for health optimization as well, which is great. And so the only things we can't do here in Quebec is because we have no defined scope of practice, we can't do anything invasive, of course, so we can't draw blood or do intravenous therapies here, pap tests or internal exams, things like that. And we can't prescribe pharmaceutical drugs in this province, but of course we have been trained in pharmacology, so it's really important to just be aware of drug-herb interactions when suggesting herbs to someone or supplements, and of course recognizing some nutrient depletions that can be helped with different supplements if someone is on a medication. So that's around about what we can do for naturopathy in Quebec. We approach health issues by trying to get to the root cause, of course, and we don't want to just palliate symptoms with supplements either. We do really want to get to the root cause of an issue. So we want to look at all factors that could be contributing. People would typically schedule an initial consultation with us, and then we'd review all the health concerns, history, and goals for someone's health, and put a plan together in the first visit, addressing diet and lifestyle. And the follow-up consultations really just depends on each person and their circumstances and their case and how much support they need. Sometimes we see people a little more frequently at first and then less frequently as time goes on. But it really does depend. It's difficult to answer that without meeting someone first. So I really want to take a little bit of time and just talk about a subject that is highly overlooked, I think, with people who get a cancer diagnosis. As we know, most of us are here because either we know someone that has had cancer or that we're currently battling something like this. So every 3 minutes, a Canadian is diagnosed with cancer, and it is the leading cause of death in Canada and is responsible for 30% of all deaths currently. Nearly 1 in 2 Canadians will have a diagnosis of cancer in their lifetime. So that's about 45% of men and 43% of women, according to Stats Canada. And so wanting to implement every measure to overcome this disease, about 80% of people currently do look into some form of complementary or alternative medicine to help while they're going through treatments and to stay as healthy as possible and to regain their health afterwards. What is causing all of this increase in cancer? When I was doing this talk a few years ago, I think it was 2015, the last time I discussed any of this. I think the stats were 1 in 3, so now it's 1 in 2. So it's really, that was just a few years ago. So it's increasing rapidly, as are autoimmune diseases as well. I think 5 to 10% of cancers can be attributed to genetics, but the rest has to do with dietary, lifestyle, environmental pollutants, EMFs, everything together. So I think it's multifactorial and it can happen from many different angles just to throw our system off. Cancer therapies that naturopathic doctors do use, I mentioned a little bit before, nutritional medicine, of course. We always want to look at everything in totality. So making sure that someone has a really good exercise plan, they're going to physiotherapy if they need to, massage therapy, just taking care of themselves. Acupuncture and Chinese medicine. Acupuncture really does help with side effects of cancer treatments as well, including pain and digestive issues, nausea. So it's quite effective. Mind-body medicine, meditation and yoga, which the center, I'm sure you've all been exposed to many of these things. It's fantastic. Education and decision-making. So we can discuss any questions that you do have that, from your oncology team and your nurses, and so you can make the best informed decision for yourselves. And support for other complementary medicines. So why do we want to change our lifestyle and make dietary modifications in the first place. We want to definitely prevent cancer from occurring in the first place. And our diets have slipped over the past few decades, and we are exposed to more processed foods, fast food prep. We're very busy. More chemicals and pesticides are in our foods due to increased population demand. So it is really, really important to make active, healthy choices and inform ourselves of what's in our food to decrease some of these exposures. In conventional medicine, when we do reach a form of remission, of course, there's a period of time when we're followed more closely. And during that time of remission, the presence of a latent malignancy is considered possible, which is why we're followed more carefully. So it is important, whatever lifestyle changes that we do make and dietary changes while we're going through the cancer diagnosis, to implement these long-term. So people who have also undergone cancer treatments are, again, at increased risk of developing secondary cancers as well. So we just want to make sure that we have as many antioxidants in our body as possible to support our cells. Body weight is a really straightforward and often overlooked subject when it comes to cancer management. So achieving adequate caloric intake and specific nutrients is really important to improve patient outcomes. This, I think, is really the simplest and most important aspect as far as intervention is concerned. And I really think a lot of education should be focused around this. The evidence just goes ignored, and it is really important to reverse malnutrition in cancer patients and put this as part of the first-line therapy. Malnutrition is prominent in individuals with cancer. Over 50% of individuals at the time of their cancer diagnosis are in a poor state of nutritional health and also may have lost significant weight. In the past, it was believed that this was a good thing because the tumor growth would also slow down at the same time as the weight loss was occurring. But then over time, they realized this was actually not the case because the individual was becoming weaker and more impaired. So achieving a healthy weight is really, really important. There was a study in the American Journal of Medicine that cancer patients, around 3,000, a little over 3,000 patients were followed through the course of their treatment. And what they did is they divided people into categories with mild cancers, intermediate cancers, and severe cancers. And they found that no matter how many people there were percentage-wise that maintained their body weight throughout their treatments, those were the people that did the best in the end, not only in terms of survival rates, but also increased quality of life. And so there are differences between advanced cancers and early stage cancers, which I think are important to address as well. In late stage cancer, we want to make sure that we don't lose weight, of course, because we want to avoid going into something called cancer cachexia, which is muscle wasting, basically. So we want to make sure that we maintain our protein stores as well as possible, eat really well, and exercise throughout. Even if we can just go for a 30-minute walk, it's really important to just stay active and breathe. And for early stage cancers, it is important if someone is overweight, and increased weight, abdominal weight, can lead to different cancers as well. We want to make sure someone achieves a healthy weight during that time and maintains it. I'm going to skip a couple slides here, 1 second. So if someone is having a hard time, sometimes when we go through cancer treatments, chemotherapy, we don't feel as well, we might get nauseous and just start decreased appetite and things like that. Really important to try and keep up our caloric intake, and usually we suggest doing power packed smoothies for this, and we can add different oils in there to increase caloric intake, olive oil and flax and fish oil and things like that. Each tablespoon of oil is about 250 calories, so you can really easily make a smoothie full of probably 500 calories and have that throughout the day multiple times. So if that's the only thing someone can get down for a few days, then that helps greatly. So the take home is definitely, we want, I'm going to mention another study, one more. So there's a study done by Dean Ornish. He is a medical doctor, a cardiologist actually, and he did a study on patients with early stage prostate cancer, and he stated the results can also be applied to breast cancer patients. He changed their diets, basically a low-fat vegetarian diet, and saw that their genes were actually altered from this. I think about 500 genes that he was tracking were altered. So you can reverse the course of disease once you have it. So embracing a vegetarian diet, exercising 30 minutes a day, and daily stress reducing activities were all part of his study. And it just goes to show how powerful dietary changes can be. There's a new field called epigenetics. So there's our genetics, our genes, which are already coded, but the epigenetics is the expression of those genes. So that is what we do have some control over, in terms of we can change things, we can impact them in a positive way if we do put in make the proper lifestyle changes at the same time. So things are progressing, and so changing your diet to have more fruit and vegetable consumption, more whole grains, decreasing saturated fat and cholesterol, and increase health promoting oils are paramount for the diet for anti-cancer, anti-heart disease, anti-inflammatory, anything like that. So for food safety, we want to make sure that we're trying to choose in-season locally grown produce and buying organic when possible. If someone isn't able to buy organic, then I usually suggest that people look at the Dirty Dozen and the Clean 15. So the Dirty Dozen is a list that comes out from the Environmental Working Group. They test the fruits and vegetables every year, and they come out with a list with the most highly sprayed fruits and vegetables. And so just avoiding those top 12 most highly sprayed fruits and vegetables, people can decrease their pesticide exposure by 85 to 90%. So that is something that we can have control over and make a huge impact. We want to make sure that we're avoiding preservatives in food and trying to eat a whole foods diet, consume a whole foods diet. And proper food storage, decreasing plastics use, food storage containers, drinking from plastic water bottles, all of those types of things can be small lifestyle changes that can make a huge difference for long-term health. Cosmetics is another area that I wanted to just touch upon quickly. It's a very highly unregulated industry when we're looking at personal care products. There are 75,000 chemicals that are currently used in North America, and about 1,500 to 2,000 new chemicals every year that are introduced. Lots of these chemicals haven't been fully tested for long-term health effects. And in combination with everything else, it can just bog down our system and increase our toxic burden. So it's important to be aware of what we're putting on our skin as well as what we're eating. As it's absorbed into our bloodstream. There are some supplements that are really great, have improved longevity and quality of life. Coenzyme Q10 and fish oil, and vitamin D, of course, is really, really important for a variety of factors. We do use different herbs and things like that, depending on what's going on with each person. But the fish oil and vitamin D would probably be the first two that I would look at to help out. There are intravenous therapies like IV vitamin C and mistletoe and Myers cocktails, things like that, that in other provinces, they are offered, and naturopathic doctors can offer them in the clinics. Here in Quebec, it's not something we can do, not at this time anyway. But in Ontario, they can offer them. So some people do travel over the border just to get their IV vitamin C and extra nutrient support from there. So I will say that my public service announcement will be for everyone to be on vitamin D. And especially since we're kind of locked in, hopefully we'll get out more these days. But it's really important to have adequate vitamin D levels, so to get those tested and to supplement. As we live in Canada and we're in a colder climate, our levels might not be optimal. So, Sandy, if you have any further questions for me, that is my...
Definitely. Thank you. My God, the information that you've given, many different information. I did want to go back when you were talking about the different fish oils. You know, the list of what is it that you mean by the fish oil?
So fish oil has been, well, fish oil has multiple benefits, whether it's for cardiovascular health, controlling lipid levels. Of course, it helps with our skin, hair, nails. But for specifically for cancer, it has shown to help prevent cancer cachexia, which is the muscle wasting that I was talking about. And it does have antioxidant properties in it as well.
Because I'm sure, you know, as you know, other people who have diagnosed with cancer are going through different chemotherapies, going through immunotherapy, many different treatments, and sometimes clinical trials where you're unable to take extra vitamins. They're really limited in the clinical trial. So when you say definitely, you know, the level of fish oil, omega-3 or vitamin D, definitely this would be a recommendation that they need to have with their oncologist, their doctor, to know the right amount that they should take.
Of course, absolutely. And while undergoing active chemotherapy or radiation, it's really important to be forthright about all the supplements that you're taking, and discuss that with your oncologist and your naturopathic doctor, because the plan will change before treatment, during treatment, and after treatment.
Exactly.
There are many things that interact. Thanks. Yes.
Exactly. And you were talking about the list of food, you know, that they were just studying, and you were saying that there was a list of the best 12 list of foods that they test. And where would we find that list? Where would we be able to know about those?
So the Environmental Working Group website, ewg.org. And if you just search a Dirty Dozen EWG 2021, they usually come out with a new list in March. So there is a 2021 list on their website.
Okay, so we would know. Okay, so maybe after you, well, we'll talk. If you give me the links in that, maybe I can.
Absolutely, yeah.
People, whoever's interested in those links, definitely that would be interesting.
Perfect.
With all the information, definitely vast information that you've given us for naturopathic medicine compared to conventional medicine. So somebody who would come for a consultation, as you were saying, definitely they meet you first and then you really assess exactly what they need. Is part of that consultation sometimes, can people have that on their insurance? Does the insurance cover it?
Yeah, so extended healthcare benefits usually do include naturopathic coverage, but each plan is different. So you have to check and see what kind of coverage and how much per visit.
Yeah. Okay. And I guess if there's certain things like people have difficulty absorbing vitamin D, does it help to take vitamin K with it? You know, some people definitely have difficulty taking vitamin D. And I know vitamin D is very encouraged, especially in breast cancer and treatment and actually a certain age for dementia and many different things. So sometimes it's very hard for somebody to have difficulty absorbing that. Is there something that can we take it with vitamin K?
People can, yes. I think most people can. It's not a problem. I don't know that it specifically helps with vitamin D absorption. Vitamin D3 would be the most absorbable form. And for those that actually have problems absorbing it, I recommend splitting the doses throughout the day and not taking like 4,000 in one go, just kind of splitting it. You'll absorb more of it at one time.
And this is all information that they can ask you when they have a consultation with you, because that's why you need to have more information about their history and what they're going through and special treatment and stuff like that. So definitely, yeah. I know there's a big question that people always say, is cancer fed on sugar? A lot of people say, is it true that sugar feeds cancer?
So I don't know that there are any actual studies that have made a direct correlation to that. We do know that sugar causes inflammation, and we do know that sugar increases our waistlines as well. So just being overweight can put us at further risk for developing different types of cancers, colon cancer, things like that. They did do a study, actually, funny enough, in the Journal of Pharmaceutical Research. It was cancer is a preventable disease that requires major lifestyle changes, and in there, they did say that reducing inflammation, there's a huge link with reducing inflammation and preventing cancer. And just changing making lifestyle changes. So sugar isn't part of an optimal diet. So when we're making lifestyle changes, that would kind of be one that I would let go of.
Okay.
Yeah.
Going back to the question for the insurance, somebody was asking, because definitely if they don't have insurance, do you have a certain, is there a consultation fee for these people who cannot have insurance?
The fees are the same. They're on our site, and it'll vary from naturopathic doctors depending, but okay. There is a fee. Yeah. And I don't think you can, some people might try to write it off on their taxes. I'm not sure about that.
Yeah, sometimes, yeah, you can try to find out in that for sure. Exactly. Okay. So I think that we had discussed, so there's so many different types of cancer out there. And actually, it's very important that if they do see a naturopathic, that they do discuss with their oncologist. And I know in Ontario, there's certain services there where they speak a lot with the oncologist, but in Quebec, really, that's not there yet where they can communicate with the oncologist. So whatever you can recommend.
It really depends on the oncologist. I've had some that respond really greatly to plans that I've put together, and they've okayed things. And I've had other ones who say you cannot take anything, absolutely not, during the course of treatment. So it just comes down to their comfort level as well. And they're responsible for that patient, right? So
yes.
Yeah.
And one of the big things during treatment, as you talked about, is able to hydrate and eating. As you say, lots of times it happens that people are losing a lot of weight. Well, the different cancers now, because you have some chemotherapy that will take and you will gain weight. Will gain a lot of weight during chemotherapy, but some people will have the treatment and will lose a lot of weight. And it's important. And sometimes it was interesting that you were talking about the smoothies. What to do when somebody cannot eat and we need to do something. So that's really, really good examples for sure. And the oils, and what oil would they put exactly?
You can put olive oil in there, or flax, or coconut, anything really that would increase caloric intake, and some ripe fruits and berries, and maybe some almond milk. It's more easily digestible. Some protein powder, vegan protein powder, things like that.
And how much oil would they put about?
Usually I recommend 2 tablespoons.
Okay.
You don't want to make it too oily either.
No, definitely, for sure. Yeah. Okay. Definitely, I have many questions I have to go through. I'm just going to see. Somebody was taking evening primrose oil for a long time because it's great benefits for your skin, for your hot flashes. It's for a benefit for many things. Can sometimes they add the fish oil with it?
Yeah, I don't think there's generally a problem with that.
Okay, so that's okay. Yeah, okay. Because I know a lot of people sometimes during their treatment, they will also take probiotics, a lot of probiotics to make sure the coat, and that too would be okay with the oils and everything. So that's good, eh?
Fine with the oils. It's just you have to make sure that it's okay with the actual treatment that they're undergoing.
Exactly. Again, always having to recommend with their oncologist to make sure that everything is okay.
Absolutely.
And is there any protein powder that you would recommend? Because I know lots of times during treatment, some people will have to have an increase of protein powder that they have to put in their shakes.
Right.
I've seen that a lot during their treatment. Is there any protein powder that you would recommend?
I don't know that I'm allowed to promote specific brands, but I think just looking for a really whole food based vegan protein that's really clean, that doesn't have, you know, if you can read the ingredients and understand what that means, that probably means it's a real food. If it sounds too chemical, then I would try and look for something else.
Perfect, perfect. And always, again, to speak with their oncologist to make sure, because sometimes that's what it is. It's the oncologist that's prescribing, encouraging to have the protein. And normally they will have a prescription at the pharmacy with the protein powder that they have to take. So definitely they always recommend that. I always know. Okay. And how would be the best? I think we had discussed that. Definitely with COVID, a lot of things have changed. So if somebody would want a consultation with yourself, how would they do that? Would they come in person? Exactly how is it now?
We offer both options, in-person consultations and virtual as well. They could be either video or phone. Yeah, so we've limited the amount of people trafficking in the office, of course, and
exactly.
We put up all these, all the precautions to stay clean and healthy and safe. But for those who feel more comfortable staying home, we can offer that.
Yes, yes. Okay, I'm just going through some of the questions. I think there was one question, but I think you've already answered that question for the intravenous vitamin. That's not in Quebec. I will send all the links after. I will speak with Vicky of certain links that she's spoken about. So it says, what is your opinion about Immune 7 supplement? Does it really help with immunity?
I don't know enough about that to answer.
Okay. Well said. Well said. Okay. Sometimes can it happen that, because some people have a lot of allergies, and in certain supplements, you know, it's very hard for them to take anything actually because of the major allergies that they have. And I guess with your consultation, you would be able to assess all these allergies and make sure products, I don't know if you can give me an example.
Don't contain the things that they're allergic to, of course.
Yeah, somebody that comes to do consultation and you know, they're very limited in a lot of things that they can eat and they can take.
Yeah, absolutely. We do see a lot of that for even just for dealing with digestive issues and allergies and sensitivities, and whether it's to chemicals or foods. So.
Yeah. And I know one of the symptoms sometimes they have during chemotherapy is nausea. I know it's not like it used to be many, many years ago, but people still have nausea. They say a lot, you know, have ginger tea, ginger candies, but some people, ginger is like, they can't anymore, you know? Is there anything that, I know ginger candies is very good, but some people, ginger makes them even more nauseated.
Right.
So definitely.
Is the taste. So acupuncture would probably be the best thing. And the acupuncturist would be able to show them some acupressure points as well for nausea that people tend to use. So that might be the most effective to get through that. The other things really are so specific, they have to be individualized because they could interact.
Exactly. And I think that's a good point that you say, like at the center, what we have acupressure. And because, you know, we need to have a medical form from the oncologist to make sure that there's no restrictions for these services that we give. And a lot of the oncologists do ask us, though, if we do acupuncture, and not recommended sometimes in certain treatments, but acupressure does help the circulation and nausea. So that I know that's very beneficial, as you say. Yes. Yeah. Some people say peppermint is good for nausea, but it depends. I mean, there's many different things for nausea. And I think it also depends on the person. Again, it can work for one and it doesn't work for the other. That's for sure.
Yeah. Yeah. And if someone has reflux or GERD, then the peppermint might not be a great idea. So that's why it's hard to just recommend something.
Okay. Again, there's a lot of questions there that are asking me, but you know, they need to know, you would need to know a little bit more about their history. And all their medication and all that to be able to answer certain questions. Because a lot of questions are about, you know, what to do for my hot flashes, my joints. I should say a lot of clients sometimes talk to me about the hormonal therapy that they take after their treatments. And lots of times people have a hard time with the hormonal therapy because it gives them joint pain, they can't sleep, so it's very difficult, and the side effects. And some people don't want to take it anymore. You know, so definitely they want to have a supplement. And I'm sure that that's something they would probably discuss with you in a consultation to know exactly. You need to know probably more information on them to know exactly which hormonal therapy and that, eh?
Absolutely. Yeah. And other health conditions that they have as well.
Exactly. So you can't just mention one. Okay.
Again, acupuncture would be great for men with the hot flashes.
I know. Yes. Yeah.
So that wouldn't interact. So I can freely say that.
Exactly. Well, you know, for us, reflexology, acupressure, energy, you know, reflexology, people don't like to have their feet, but reflexology in the hands and that also helps a lot with nausea and circulation and neuropathy. You know, it really
Absolutely
helps a lot. So because a lot of the chemotherapies have those side effects of neuropathy, and it's very difficult for that and to prevent that for sure. Okay. I don't know if anybody has any other questions, because a lot of it is about nausea, and I think people were giving their own recommendations, which was good. Fennel, chamomile. A lot of people are talking about hot flashes. Some is talking about bioidentical hormones. Do you know of that?
Yes, we're not allowed to prescribe in Quebec, but I usually do just send the referral over to the NDs we collaborate with in Cornwall, so it's not too far if someone is looking for something like that. However, with a previous cancer diagnosis, if it was hormone positive, then bioidenticals may not be the best option either.
Okay.
So
it's better to have a consultation in that, definitely, for sure. Okay, I think that we've asked quite a bit of questions. It was very, very interesting, definitely. It would be great to have the links that you were talking about. I had written myself some notes. There's one thing that you talk about, cosmetics. You were talking, I don't know if you could talk about that a little bit again, because it's a lot of people going through treatments. You know, they have certain allergies and they cannot have what cream to put, hand-foot syndrome or during chemotherapy. So definitely, can you talk a little bit more about that?
Sure. I'm not sure which aspect about decreasing toxin exposures in general. Yeah, so it is really important when we're cleaning up our diet that our lifestyle is also cleaned up. So when I talk about our increased toxic burden, we just have things coming at us from all angles. So one is from pesticides and hormones and antibiotics in our food. Then we have cosmetics and personal care products, shampoo, body creams, makeup, everything, deodorant, that have chemicals in them as well. And our air is also not perfect. We live in a big city, so the vehicular exhaust is also a problem. And then we have the EMFs and the radio frequencies that are increasing around us. So all of this starts to take a toll on our bodies. We probably weren't meant to live in society like this. So if I'm not saying to be scared of everything, walk around in a bubble outside, but what we can do at home is to decrease our daily exposure. So we can clean up our food. We can choose the dirty dozen. I'll send the link after. We can just watch for heavy metal exposures, like decrease our tuna consumption, things like that, and choose cleaner natural health products, of course. So just learning to read labels. There's a great website on the environmental working group called Skin Deep. I can send that link as well, and that way you can check out some ingredients if you're questioning purchasing the same product again, or maybe getting something different, a little cleaner, you can plug it into Skin Deep and see if there have been studies on that are increased carcinogenic or allergenic or immunotoxic, endocrine disruptive, all of it. So just kind of decreasing all those exposures will help your body function a little more efficiently.
Okay. I saw that somebody wrote down in the chat actually that they found the Dirty Dozen website, which is www.ewg.org, food news /dirty dozen. Okay, it's very interesting. So we'll have to look at that for sure. Okay, I think if there's any other questions, please write it in the chat, definitely. And I think for me, I didn't know if you wanted to add anything, Vicky. This was very, very interesting. And again, if there's all the links that we talked about, yeah, you and I will talk about, so you can give it. And if anybody's interested in the links that Vicky spoke about, definitely you can contact us at the West Island Cancer Wellness Center. Somebody was asking a question about how do you find a good reflexologist? Again, call the West Island Cancer Wellness Center and we will refer you to, we have great reflexologists, but we will refer you to anybody who's outside. And I think that's it, everybody. I don't know if you're seeing, but they're saying thank you for all the information. And
thanks for having me. That's really great.
Yeah. So I think this is it. I don't think we've spoke about CBD oils. I don't think that's something that we can talk about. But yeah, I think this is it.
Perfect.
Thank you very much, everybody. Thank you for coming. And again, have an amazing day.